So now let us understand that how the peripheral arterial disease presents. So basically a patient who has been diabetic for some time or is a smoker or atherosclerotic, they are the patient who can have peripheral arterial disease, and this suspicion should come when the person is having severe calf pain on walking. So generally this patient, they will complain of severe calf pain after walking for about say 100-200 meters or 500 meters, and slowly the walking distance, the claudication distance reduces. That means a gentleman who was able to walk freely for about a kilometer, he will start experiencing calf pain after walking for say 500 meters. After some days 200 meters, after some days only 100 meters they can walk freely without pain. So that is the first symptom. The first symptom of peripheral arterial disease is you have severe calf pain on walking, and the pain gets relieved once you take a little bit of rest, which we call it as a claudication. Now these patients, slowly, if they are not identified or treated, the ischemia, that means the reduction of the blood supply, further aggravates. Hence slowly the leg color might change from the normal pink, real good supplied limb, how it looks like, to less lively, dry and bluish discoloration, which we call it as a pregangrenous change. That means the tissue in the leg, they are going to die. So most commonly peripheral arterial disease patient who will have the next level of symptom beyond the claudication, they will basically experience the pregangrenous changes, the discoloration of the limb, and the limb will feel cold compared to the other side. And obviously if the patient can feel the pulses, he'll just be missing those pulses in those limbs. So these are the symptoms of peripheral arterial disease in increasing severity. And still, if we don't treat the patient in claudication or pregangrenous change, it goes on to a gangrene. Gangrene means a dead part of the tissue, or there could be an ulcer which is not healing. We see many patients who are diabetic, they develop an ulcer. Many of them, the ulcer is because of lack of good blood supply, that is because of a peripheral arterial disease. They are having these symptoms where the ulcer is not healing. So these are the symptoms. Number one, claudication. Number two, there is an ulcer which is not healing. Number three, pregangrenous change. And number four, this could be a real gangrene and a need for amputation. So these are the various symptoms of peripheral arterial diseases. Now what we do when a patient of peripheral arterial disease come to us? Interventional radiologists deal with peripheral arterial disease a lot. So what we do is, once the patient comes, we do some investigations. The investigation, the most common investigations could be a Doppler test. After a thorough clinical examination, we do a Doppler ultrasound test, which will tell us that what is the status of the blood supply into the leg. So we will see the groin blood supply, then the leg blood supply, and the below knee blood supply, and all the way to the pedal arch at the foot blood supply we will see. And if there is a suspicion of a block, then we can go to the next level. Sometimes we do a CT angiogram done through a CT scan, or we do an angiogram through an MRI, which is called an MR angiogram, or we call a DSA angiogram. That will tell us exactly that how many vessels are involved, which vessel is occluded, and how to treat them. So once we get those informations, basically, then we decide for the treatment. Suppose the occlusion is very minimal, then we give some medications to the patient. It could be some blood thinning agent in form of ecosprin with some rivaroxaban, and then we can give some cilostazol, which can improve the microcirculation of the leg. We will encourage the person to walk and do regular activities and exercises, and then to control the diabetes. And then if the patient is smoking, obviously we will ask to stop smoking, and atherosclerosis, we can give anti-cholesterol medications. Like that, we treat those patients in the first stage. If they have gone beyond the first stage, then obviously an angiogram showing a major block which needs to be treated, then we treat them. The treatment is in the form of angioplasty and if required a stent. So we have the regular balloon angioplasty and the drug coated balloon angioplasty. The angioplasty is a simple procedure where we put a small wire through the block and we take a balloon and we inflate the balloon, hence creating a path. And once the path is created, the blood flow is re-established, and that treats those symptoms and the disease per se. Thank you.